Welcome to the Pension and Insurance in Israel podcast with Bosman. This podcast is for those who've recently made Aliyah and are new to Israel, here to help you understand the world of pensions and insurance. Today, we're taking a deep dive into private health insurance. It can feel a bit like jumping into the deep end, especially with the added layers of Kupet, Cholim, and Shaban. But don't worry, we're here to break it down and help you understand why that third layer, private insurance, is so important.
You know, it's really about creating a safety net for those just-in-case situations. Think of it like having car insurance, but for your health, those unexpected major issues. Needing a specific medication that isn't on the standard list, facing a transplant situation, or requiring surgery abroad. That's where private insurance steps in.
So it's about being prepared for the unexpected. Makes sense. But if I'm just signing up for insurance, wouldn't I be covered immediately?
Well, that's where the concept of a waiting period comes in. Most policies have a 90-day waiting period before the benefits actually become active. It's definitely something to be aware of as you're planning your healthcare strategy.
Okay, good to know. You need to plan ahead. So that's what's considered basic coverage. But then there's also supplementary coverage, right? What's the difference?
Think of supplementary coverage as optional add-ons to your basic policy. They can cover things like dental care, enhanced vision benefits, or alternative therapies. The thing is, some of these might overlap with what your Shaban already offers. So it's a bit of a puzzle figuring out what gaps you actually need to fill.
That makes sense. You don't want to pay for coverage you already have. Okay, let's unpack those basic coverage benefits. Starting with medications, our sources really emphasize how crucial this is.
Absolutely, and this might surprise you. But the current healthcare budget allocated for medications in Israel is only 700 million shekels. However, to cover all the necessary medications people actually need, that budget would need to be closer to 3.5 billion shekels.
Wow, that's a huge difference. No wonder private insurance for medications is so important.
Exactly. It bridges that gap by giving you access to medications that aren't included in the standard formulary provided by the public system. This could be a newer, more expensive drug, or even an experimental treatment that could be life-changing.
So without private insurance, some people might face impossible choices between their health and their finances. Our sources actually mention a couple of real-life examples, right?
Yes. There's the example of a newer, more effective Ritalin substitute. That could cost around 3,000 shekels per month without coverage. And for those struggling with psoriasis, there's a specific medication that could easily set you back 13,000 shekels.
Those are not small amounts. It really puts things into perspective. Okay, moving on to another major aspect of basic coverage, transplants. This is obviously a sensitive and complex topic.
It is. Sadly, Israel faces a severe organ shortage due to low donation rates and the legal framework surrounding organ donation.
So even though the ID card system allows people to express their wish to donate, there are still many challenges.
There are. Even if someone has an ID card, their family can still overrule their decision after death. It's a difficult situation. This means that out of the 3,350 to 1,500 people waiting for transplants, only about 15–20% actually receive them.
That's heartbreaking. What role does private insurance play in all of this?
While it can't help with transplants within Israel, it can open doors to getting a transplant abroad. Private insurance can assist in finding suitable medical centers overseas and, crucially, cover those extremely high costs that are not funded by public health care.
So it's about increasing the chances for those in desperate need of a transplant. Now let's talk about that third part of basic coverage, surgeries abroad. When would someone even need that?
There are a few scenarios where this becomes crucial. Imagine needing a highly complex procedure, wanting to be treated by a world-renowned specialist, or simply needing a treatment that isn't available in Israel. In those cases, having coverage for surgeries abroad could be essential.
I can imagine those costs would be astronomical without insurance.
Absolutely. We could be talking hundreds of thousands of shekels, which for most families would be financially devastating. But that's where private insurance comes in. It covers things like the surgeon's fees, hospitalization, operating room costs, even the anesthesiologist and any specialized equipment needed.
That peace of mind must be incredibly valuable. However, I did notice that our sources mention a potential catch with coverage for travel and accommodation.
That's a good point. Some policies might have limitations on travel and accommodation, especially for longer stays or if you're traveling with children for surgery. While some might cover the accompanying family members' expenses, it's not always the case.
So it's important to understand those details, and maybe even shop around for a policy that offers more comprehensive travel coverage, if that's a concern.
I completely agree. Clarity is key when it comes to these details.
Speaking of clarity, let's shift gears and talk about surgery coverage within Israel itself. I know public health care covers surgeries, but there are some downsides, right?
You're right. While you can absolutely have surgery within the public system, you might not get to choose your surgeon. Also, waiting times can be quite long, and you might not have access to the newest surgical techniques available.
So how does having private insurance change things?
Private insurance allows you to choose your preferred surgeon from their network. It also often means shorter waiting times and access to private hospitals, which can be a significant advantage. You might even be able to choose a less invasive procedure, which can be a huge plus.
It's still about having more control and options. But I understand there are different levels of coverage even for surgeries within Israel. Can you explain those?
There are two main types, first shekel and Shaban supplement. First shekel is the most comprehensive and allows you to choose any surgeon within your insurance network. Shaban supplement, on the other hand, is a more budget-friendly option. It covers surgeons who are in both your Kupat Chalem network and your private insurance network.
So with Shaban supplement, there's an extra layer of checking involved.
That's right. If your Kupat Chalem covers the surgeon, great. The surgery is managed through your Kupat Chalem's supplementary coverage. If they don't, then it works like first shekel. You choose your surgeon from the private insurance network, and the insurance company takes care of the rest.
So it's about understanding how those two systems interact. This has been incredibly informative.
We've only just scratched the surface.
Stay tuned for part 2